Breathing provides the body with the oxygen necessary for survival and eliminates carbon dioxide. To reach the lungs, air can pass through the nose or mouth. In today's video we will see the difference between oral breathing and nasal breathing, and we will understand why it is preferable to breathe through the nose. Hello and welcome to Med4Care. Today's topic is oral breathing. Normally, correct breathing occurs through the nose, where the air warms and humidifies, entering the body. However, some people tend to breathe predominantly through their mouth. This condition is known as mouth breathing. It is no coincidence that many sports, meditation and psychophysical well-being disciplines give fundamental importance to learning the right breathing techniques. In pranayama, for example, a discipline of Indian origin, correct breathing is preparatory to carrying out the training course. Unfortunately, the modern lifestyle and various environmental factors strongly contribute to the spread of the bad habit of oral breathing. A state of anxiety, stress or worries lead to shorter and shallower breathing, mostly oral. Correct nasal breathing is more demanding due to the greater effort it requires. And so we could ask ourselves, why do we need to breathe through our nose? As the air passes through the nose, it is filtered, warmed and humidified. If we exhale through the nose, the airflow is slowed down thanks to the greater resistance, between 50 and 200% greater than oral breathing. Thanks to the greater resistance to passage through the nose, air is retained longer in the lungs, and therefore the amount of oxygen released through the red blood cells increases. All this stimulates the elasticity of the lungs and strengthens the thoracic muscles. Furthermore, the effort that the rib cage makes in nasal breathing creates greater negative intrathoracic pressure, which reduces cardiac fatigue. Finally, the greater supply of oxygen to all organs and muscles will translate into greater physical resistance during efforts and greater efficiency and well-being. On the contrary, mouth breathing has consequences that can even be serious, both in children and adults. First of all, the circulation of air in the nasal passages is reduced, so stagnation, dryness and cooling favor most of the recurrent pathologies of the respiratory tracts. Mucus production intensifies in the hope of capturing more oxygen. The increase in mucus therefore reduces the ability of the anterior nasal passages to allow the passage of air. Furthermore, mucus stagnation creates inflammation and infections, causing the formation of sinusitis and polyps. The same process can occur for the posterior nasal passages, with inflammation of the adenoids and tonsillar hypertrophy. It's not over. Inflammations and infections of the nasopharynx via the eustachian tube are transmitted to the middle ear, causing ear infections, hearing loss, tinnitus and labyrinthitis. Just think that the 2019 Nobel Prize-winning scientists in physiology and medicine have discovered how, in conditions of limited oxygen availability, cells use their energy reserves to compensate for this condition and are an easier target for cancer. Another important aspect is that the lungs extract oxygen from the inhaled air, especially during exhalation. Therefore, by increasing the respiratory rate, the oxygen absorbed is reduced. In fact, if we exhale through the mouth, the passage of air is facilitated, so the air in the lungs does not remain much, and the oxygen absorbed is drastically reduced. The reduced oxygenation of the tissues causes a greater stimulation of the automatic respiratory centers, which consequently intensify the rhythm of breathing, favoring heart attacks and strokes. Let's see together what the causes of mouth breathing are. Mouth breathing is classified into three categories: obstructive, anatomical, habitual. Oral breathing of an obstructive nature is produced by the obstruction, generally temporary, of the nasal airways, which can occur due to inflammation and infection or the presence of mucus inside them. We are therefore talking about the common cold, rhinitis, sinusitis, allergies. In anatomical oral breathing, there are specific situations that prevent the passage of air through the nasal passage. Septum, nasal polyps, hypertrophy of the turbinates, hypertrophic adenoids. Finally, habitual oral breathing occurs as a consequence of stress or anxiety. But the main cause of oral breathing is the almost complete lack of education in nasal breathing. Recent statistics show that approximately 50% of children have incorrect respiratory function. If this incorrect habit persists in children, normal body growth may be slowed down and normal facial growth compromised, with jaw dysfunction, facial elongation, accentuated and dark circles under the eyes, incorrect posture and chronic fatigue. In adults, in addition to many of the problems mentioned, cardiovascular problems can be added, such as hypertension, arrhythmia and sleep apnea. One of the most underestimated consequences of mouth breathing is the reduction of carbon dioxide in the blood. But how? You say. Isn't carbon dioxide a waste gas that needs to be got rid of? In reality, it has important functions, the main one being the regulation of breathing. A low level of carbon dioxide in the blood increases breathing rate. Another important function is that of being responsible for the release of oxygen from hemoglobin to the tissues. The reduction in carbon dioxide levels also induces the hypersecretion of mucus and therefore the narrowing of the airways. Another consequence of mouth breathing is dehydration. The air that enters our body is particularly low in water vapor, while that present in the lung is rich in it. During the passage through the airways, the organism must progressively humidify the incoming air. This process is much less expensive if you use nasal breathing. Finally, oral breathing worsens anxiety states. In common states of anxiety, breathing changes, becoming more frequent, shorter and more superficial, hence the term hyperventilation. In conclusion, the prevention of oral breathing is of fundamental importance. We have seen so far how important nasal breathing is and what little-known consequences there are for the body if mouth breathing is chronically used. It would be more appropriate for the various health professionals to carry out prevention and dissemination of these concepts among their patients so that the population can give the right importance to nasal breathing. We have now reached the end of today's video. We hope you liked it. If you found it useful, support us with a nice like, subscribe to the channel and click on the bell to be notified every time a new video of ours comes out. See you soon on Med4Care.